to the real world out there. I know I didn't give any notifications to anyone out there, but let's go ahead and remove this right now. We got a great little program for you, and been doing some research, and I'm sure I'm going to have a lot of surprises out there by a lot of my subscribers. I'm sure that they're just getting the notification now, and they're saying, wait, why so late? Well, anyways, I'm going to talk about osteoporotic problems with calcium problems. Hello there, Darshan. You're the first one in from India. We kind of surprised you. I didn't go ahead and put an alert out to any of you guys tonight. I decided I wanted to get this thing recorded on my channel, something that people are always asking about. Something that I think you guys are going to enjoy. It's calcium, as well as vitamin D. We're going to talk about bone strength, bone health. And I have a lot of good things to share. For those people who are just tuning in, you're going to be able to go to my channel. You're going to be able to see this on the channel, and you're going to get a whole lot of great information. This is a very, very important topic, and I think it's going to really help a lot of people out there. So let's go ahead and let me just get this set up just for a second. And we're going to touch on some very important things. A lot of people out there who have particular osteoporosis, they have weakening of the bone, they have pathological fractures, they have hip fractures, they have very weak bones, they start developing this hunching because of this osteoporotic problem. Hello, all my good old people there in the chat room. I want to say howdy to everyone out there. And so this is really going to get you to understand something, because what happens is we're not little kids anymore. And as we grow up, we don't spend a lot of time in the sun. So one of the most important things that we're going to talk about today, and we're going to spend time on this, is vitamin D. Vitamin D obviously helps maintain calcium balance. So if you're not getting vitamin D, you're not assimilating calcium. People out there are taking calcium. Good morning, surprise. Hi, Laura. People out there who aren't assimilating calcium because they don't have vitamin D. Vitamin D is probably the most deficient vitamin in the world today. Hi, Melissa. So this is something that you guys really need to understand. Did you know that if you don't get in the sun, then you're not primarily getting the vitamin D that your body requires. Now, let me just tell you how powerful vitamin D is. There are people out there who are having muscle cramps, who are having pain in their muscles, pain in the joints, people who are always getting sick, a weakness in your immune system. What about your blood pressure? You notice the regulation of your blood pressure is high and low. It's not normal all the time. You're getting sick quite often because potentially you're deficient in vitamin D. Now, if you look at how to get the best amount of vitamin D, it's obviously sunlight, and we're going to talk about that. But because I, nor most people, don't spend that much time in the sun anymore. Hey, Mitch from New Jersey. This is something that you're going to understand this, because in order to get calcium in the bone, you need vitamin D. If you don't got vitamin D, you could be dosing on your calcium intake, your calcium magnesium intake, your calcium phosphorus intake, whatever you're taking, you're not getting the D to the bones. It's not getting in, I promise you. So this is going to open up a whole lot of sunlight in your mind. So by far, salmon is one of the richest amounts of vitamin D's we can get. Now we're going to talk about other ways you can get, but a fillet has 14 IUs, international units of vitamin D. And the key thing is when we go out in the sun, we have to be out there at least 10-15 minutes, and we have to expose a wide portion of our body. We just cannot keep our hands exposed or maybe our toes exposed. We need to get a lot of exposure on our chest, on our head, on our back to really get that vitamin D. Now, you're going to like this, guys. This is a great little topic. Sunlight is the magic. Yes, we get a lot of good stuff from the earth. If you look here, vitamin D, fish, cheese, butter, margarine, milk, cereals. Obviously, our body takes the energy and we make vitamin D, but most of us do not get the sunlight. Now, you have to understand that a lot of states and countries out there particularly in certain parts of the year in wintertime, there's not a lot of sunlight. So just because of the fact you may not live out in South Florida where I live, or you may not live out in the Bahamas or in the islands, or maybe in sunny California, but if you're in a particular country or state and you don't have a lot of sunlight, you are getting deficiency of vitamin D. Now, what about people that don't go outside, that maybe hang out, that spend a lot of time under the ultraviolet light, maybe inside at work, where you don't really go outside too often? What about countries out there, maybe like England, where it's always raining all the time? You don't spend a lot of time out there. So that's another very important thing. So when we look at vitamin D, and I mentioned this to you before, the flu, getting cancer, muscle aches. That's a big one we're going to talk about today, because muscle aches is a big thing with deficiency of vitamin D. Guys, you think that maybe it's your disc, or maybe it's your degeneration, or maybe the pinching on the nerve, or maybe your poor posture. I can promise you that a great amount of you guys and ladies, gentlemen and women out there are going to see changes by just increasing vitamin D. And I'll talk about how much, the dosing, and I'll talk about all that good stuff for you. Cardiovascular disease, depression. A lot of people get depressed. People in Alaska get depressed because they're never in the sunlight. Diabetes, you can reduce the risk. You can reduce the risk of autoimmune. And the big one is osteoporosis. Osteoporosis, and I'm going to talk about that because that is strictly a lack of vitamin D, because calcium can't get inside the bone. So when you lack calcium, guess what, guys? You're lacking vitamin D. If you look here, this is a little bit complex, but I'm briefly going to just go ahead and tell you that when the sun hits the skin, you get 7-dehydrocholesterol that turns into cholecalciferol, vitamin D3. It manufactures in the liver. It then forms 25-hydroxyvitamin D3. It filtrates through the kidneys and it helps maintain normal calcium balance in the body. Now, obviously, vitamin D3, the dietary intake, you can see, is primarily fish, meat, and obviously other dairy we talked about, but the vitamin D2 are the supplements. But don't worry so much about that right now, because most of it are going to be D3s. So let's move on here to this particular thing. And as we talked about the summer versus the winter, the sun exposure versus not enough sun exposure, that is a very big problem. So that is something, guys, that you just need to keep that in mind right now, because that's a big problem. Now, we talk about the vitamin D, how it promotes calcium absorption. There's a lot of situations, different things. I don't want to go into this so much right now, but overall muscle strength. There are studies out, big studies out, that people who fall a lot, that may develop like hip fractures. As you get older, you just seem to fall. Guess what? When you have more vitamin D, your muscles are stronger. Guys and women, if you go out and play sports and you want to exercise, you want to run, you want to be a better athlete, you want to have more endurance, you need vitamin D. It's extremely important. Now, we talked about here 10-20 minutes a day. Make sure it covers a lot of the part of the body. Now, supplementation, I take 5,000 IUs a day. My vitamin D was low, but guess what? It's still not real high. You'll find a lot of doctors that will give you 50,000 IUs once a week, but average, I would say 1,000 to 2,000 IUs. That's supplementing. Okay, I don't go in the sun much like I did when I was a kid. All right, I take 5,000. Sometimes I'll take 5,000 for a week and skip 1 or 2 days and go back to 5,000. And I rechecked my vitamin D, and it's still not high. It's in the middle still. But my vitamin D level was low. And vitamin D has a big thing with the immune system. If you're getting sick and you feel weakened, you feel tired, your muscles feel weak, it's because you're deficient, a lot of us, in vitamin D. You can go ahead and look what people are writing out there, how much they take out there, and I'm sure you guys can learn a lot from the chat room. Now let's go into this particular thing right here. This right here is an osteoporotic compression fracture. If you look at the normal vertebrae above, that's normal matrix within the trabeculae of the bone of the vertebrae, and below you have an osteoporotic vertebrae in the middle, and the bottom you can see a compression fracture. So in other words, we see people as they get older, not even when they get older, but they're hunching over because compression fracture after compression fracture. Let's show you guys that, this is the way the curve's supposed to be, like this, but as these vertebrae here start to collapse, this is what happens. Little by little, and you start developing that hunching, that hunchback of Notre Dame. So very, very serious, guys. And ladies, you really need to look at this thing very carefully. We look at that little skeleton. He's dying for that calcium, okay? Because 99% of your bones are calcium. And I want to go into some facts with you guys, and I'm going to explain some things a little more thoroughly with you so you can really understand. As we talk of muscle spasms, joint pain, your brittleness of your nails, your hair, your immune system. These are some deficiencies. Brittle nails are a very big one. People looking for zinc. It's more calcium than zinc. Okay, so this is very important, guys. Muscle spasm. Calcium is so important. Also, guys, I want to throw in magnesium. If you're getting a lot of twitching in the muscles, if your muscles are feeling aching, magnesium and calcium are very, very important for the muscles. I just want to throw that out at you, okay? Here are some other deficiencies: teeth discoloration, poor appetite, and again, everywhere we go, aching in the muscles, aching, a big, big one when it comes down to low calcium levels. As we look at here, guys, we look at fracture of the hips, very common, not even in the elderly today, because there's osteoporosis, and if they fall, they don't really take a big fall, that is causing those bones to really fracture pretty easy. Here is a fracture of the L1 area, the lumbar spine, upper lumbar spine. It's a compression fracture. I see so many compression fractures in practice over the years. I see so many, and you know what? Many people don't even know it. And Fearless Legend, yes, you said the way you know if you are deficient, you need to get a blood test, a vitamin D blood test, guys. Very, very good point, because it's not going to be able to be tested through the urine. It's a very good thing to do. Now, obviously, they have bone density tests and everything else like that. But even if your bone density test is normal, you still can be deficient. Now, think about this, guys. If you have normal integrity of the bone and your bone density test is normal, guess what? Your bones take the calcium from the blood. So in other words, it's taking it out of the blood to go into the bone. So the bones are normal, but you could be deficient in the blood. So yes, you're very right about that, Fearless, and you need to really let other people know that. It's really important. So we look at the osteoporotic spine here. I just want to go over a few very important things with you guys. I know this was late, but I know I catch a lot of the guys over on the other side of the world, and I like working late. I think it's a great thing for all of us. It's just something different. This is very sporadic. So let's go into a couple of very important things about calcium. People are asking, where do I get this from? Well, skim milk. I like to reduce fat. I like yogurt, Swiss cheese, any type of calcium fortified cereal, tofu. I'm not really big with tofu because tofu increases estrogen. Estrogen increases cancer. Quote, other problems that can happen. I'm not really big with too much tofu. I also want you to know that basically we need that vitamin D, and the vitamin D can anywhere from 1,000 to 2,000 IUs if you're supplementing. I take 5,000, and let me tell you, I think 5,000 is fine. I've been doing that for quite some time, and I rechecked my vitamin D, and I'm still not high. Good source of vitamin D are fatty fish, egg yolks, as we talk about the vitamin D fortified milk. I don't really like people out there basting in the sun to try to get vitamin D, particularly in certain areas of the country. The sun rays and the ultraviolet rays are very dangerous. And again, skin cancer here, particularly in South Florida, is probably one of the highest in the world. So even those people who have sun protected on them to prevent those ultraviolet rays, that really is not allowing you to get the full amount of vitamin D. Now, the stats and the recommendations here talk about children, adolescents. They talk about vitamin D ages 1 through 3. They talk about 400 IUs and calcium about 500 milligrams. But let me just give you a rough thing because I don't want to go through all the figures. They could be quite confusing. I think basically the average number for calcium is about 1,200 milligrams of calcium. And the average number for magnesium, I would say, is between 1 and 2,000 IUs. Now I can be specific on different ages. Now obviously as you're a baby or as you're a child, you need less as compared to when you're an adult. But again, the most important thing, we talk about overdose of vitamin D. Yeah, you really have to overdose. I don't really know anyone who overdosed, but if you're taking 2,000 IUs or even 3,000 IUs, you're far, far away. And you know what? There are other studies. You can go ahead and read up on the internet and read up on Google that people who take more vitamin D, not that they're overdosing, they're benefiting in so many other ways. They're benefiting in so many other ways. The other thing I want to mention here, guys. Let me just see if I'm leaving anything out for you guys. I don't want to go into all the little details and studies, but here they talk about tips for increasing vitamin D, some good fish, and I think this is really important. Swordfish, if you guys like swordfish. I don't know, really what part of the country or world you live in. Sardines, excellent. Fatty fish, really, really good. Mackerel, salmon, bluefish, excellent, excellent. Now, if you're not really getting enough of these foods, I do recommend to supplement because I don't really recommend people out there to risk the sun cancer. Now, the other thing I want to mention about calcium, there are different forms of calcium. I'm not going to go into all the different forms, but like the calcium carbonate, which is your worst kind of calcium, that is kind of like your Rolaids and your Tums and your antacids. People who take a lot of that can get a rebound effect where you can start developing more acid. A lot of people who have heartburn, they're taking these Rolaids and Tums and these calcium carbonates. That will help solve the problem temporarily, but the body rebounds and puts more acid. There are different kinds of calciums, and I do recommend you search through Amazon, do your homework, go to Google, go to your health food store, speak to nutritionists and people who work there, and there are other formulas that have calcium, magnesium, because yes, it is good to have magnesium. Magnesium prevents calcium from being assimilated into the cells like kidney stones. My basic formulation is generally like half the amount of magnesium. Magnesium is one of the most important, and I don't want to get into magnesium now, I'll get into another time, but magnesium for people who take certain types of medications, like blood pressure medication, you will become more deficient in magnesium. So for those kind of people who can't sleep well, who are getting twitching in the muscles or cramping in the muscles, magnesium is a very important thing. And one last tip, guys, I want to give you, if you're noticing that you're very tense and you're very nervous, you're very wound up, and you want to relax, there are other things I can recommend, like valerian root, which is an excellent herb. But if you just increase magnesium, it can do wonders for you. Well, that's it about, guys. I just thought that I would throw this together for you. I really hope that you benefit. YouTube will post this on my channel. And again, there's a lot of things that, I understand you guys are asking me this, but I'm going to recommend that you just Google it for right now because I really want to condense these videos that when people look at them, I don't really want to be wasting too much time. I just want to get to the facts. By the way, guys, my Facebook, Motivational Doc, is really the best way to communicate with me there. I do have emails, but I get about 400 a day, 300 to 500 a day. And I just wanted to let you know, a lot of love out to you. And go ahead and like the fan page over at Facebook. It's Motivational Doc. I'm working on other things like my site and everything like that. But right now, I'm just so busy doing other things. But I enjoy coming out here. And, what I love about this is that I don't have to really spend much time editing because YouTube takes it, they put it right on my channel, and I'm kind of done. Anyways, guys, good night to those in the U.S. Good morning to those across seas in India, in Thailand, in China, in Hong Kong, and even those people in Europe right now. You are obviously morning time right now, 6 hours ahead of me. Well, guys who came out and, with giving me courtesy and respect in the chat, I want to say, thank you guys. And we'll continue to educate you and give you a whole lot of great more information. Get some rest, guys, if you're in the U.S., and God bless you. Have a great day. One last thing I want to mention, which I always forget, but if you have not subscribed, please do so. A lot of great information on my channel. We have over 1,000 videos. YouTube is kind of ranking my ranks real high up on neck pain. Those people, if you just type in neck pain through the search, all my videos are coming up at the beginning. Thank you, YouTube. But most important, people are becoming educated. And what's nice, we talk about the poor posture and everything like this. Children, teenagers are all starting to watch these videos, and it's really helping a lot of the kids as well. So we are doing good things. God bless you guys, and we'll catch up with you real soon.